Welcome back. In the last video, I talked about the therapeutic alliance. Basically, that when scientists study any form of talk therapy, they find that the most important or the best predictor of outcomes, where clients go from bad to better, is the quality of the therapeutic alliance. That is the relationship between the therapist and the client. The warmer it is, the more compassionate it is, the more empathetic, accurate, and genuine it is, the better the outcomes for clients are. So that ties into the style of therapy that I do. So the style of therapy that I engage in is called client-centered therapy. It was developed by Carl Rogers in the early part of the 20th century. Basically, Carl Rogers proceeded on the assumption that the client was the expert on what was going on in their life. And the therapist was not there to fix them or change them or tell them what they should be doing or what they were actually thinking or feeling. But the therapist's job was to provide sort of a mirror, a compassionate, loving mirror to the client of what was going on in them. And through doing this, through not introjecting, through not trying to tell the client what was wrong with them, the client would begin to process the difficult things that were going on in their life better. They would feel like they had a partner, they like someone there dealing with the stuff with them, and they would feel that over time they would be able to better handle issues because they felt like they were able to deal with ones in the past. They would be able to find clarity in their thoughts and know how to move forward. And over time, they would stop worrying very much about how other people viewed them or what other people thought. And they would gain more and more trust in their own thoughts and their own ways of being. He was a very influential therapist, and many even modern schools that aren't even exactly his school of therapy, they still use a lot of his principles. So this is the kind of therapy I do. I basically focus really hard on having a genuine relationship with the client. I focus on deeply understanding what's going on at the surface level, at the level of feelings, at the level of deep meaning and value. And then I also am very warm. I hold the client in high regard, not as someone who needs to be fixed, not as someone who's bad, but as someone who's good, someone who's, dealing with a lot. So that's client-centered therapy. That's the kind of therapy I focus on. In the next video, I'll talk about how it works in practice, what you can expect.